Welcome students. This is for 6th semester students, the continuation of Nutraceuticals Lecture number 5. In this we are going to discuss about the nutraceuticals in gastrointestinal disorders. There are many gastrointestinal disorders which are being more discomfort for every one of us. Some of them are very chronic and which was repeatedly having lots of issues which can be prevented instead of having continuous medication for a long period of time. We can prevent this disease by means of taking various nutraceuticals. So we should know about how the nutraceuticals as a food which can help us in this gastrointestinal disorders. Here, functional gastrointestinal disorders or functional gastrointestinal disorders refers to conditions of normal body activities such as the sensitivity of the nerves in the intestines, the movement of the intestines, and the way that the brain controls the intestines. When are impaired while no structural abnormalities or abnormalities can be observed by endoscopy, X-ray or other tests. The most common problems affecting the gastrointestinal tract are altered mucosal and immune function, altered gut microbiota, motility disturbance, visceral hypersensitivity, constipation, irritable bowel syndrome, functional dyspepsia. In this few major discomfort repeatedly happening in GIT can be treated as well as can be prevented by means of using nutraceuticals. Selected 4 gastrointestinal tract disorders can be supported with help of nutraceuticals. Number 1, constipation. Constipation is a condition where a person has infrequent or uncomfortable bowel movements, usually fewer than 3 times a week. The bowel can be hard, dry or lumpy, and it can be difficult or painful to pass. Every day evacuating bowel is the best system. Early morning is a good system of doing small exercise. Having little hot water will evacuate your bowel. So this is somewhat old age people, the constipation, rectum stretched and overloaded with poo. You can see the picture. That is one. When worse condition, you can see in large intestine, the poo backed up through the large intestine in many places in the picture which I am showing there. So these conditions are more difficulty for the patient to have their comfort of movement. So the drug which we can use is Senna, everybody knows, is one of the most used therapies which comes from an important class of botanical or botanic laxative, anthraquine glycosides or anthraquine drugs. This is Senna, Alexander and Senna. And you can see the class also have, that means the class means we are talking about the anthraquine glycosides also have cascara. The picture which shows cascaras, sagrada, frangula, common known as buckthorns in the flowering plant family, Rhamnaceae, aloe, we know aloe vera, and rhubarb. It's underground. The rhubarb include, and it is enriched in corresponding plants and herbs in forms of glucoside derivatives of anthracene, that is anthraquinones, anthraquinone glycosides. Phylum Ispagul, Plantago ovata, desert Indian wheat, and the husk is also available in the market. Very efficient laxative. And you can see psyllium or phylum, or psyllium you can say. Psyllium is a frequent bulk laxative for constipation. Psyllium was demonstrated to increase stool frequency and improve stool consistency. Ispagul husk is also available, and this seeds are having a capacity to give a enlargement in size and giving pressure, and they are acting a very good laxative in constipation. Mixed fibers is well tolerated and more effective in alleviating flatulence and bloating. Irritable bowel syndrome, the second one, IBS. In irritable bowel syndrome, you can see the picture how irritable bowel syndrome affects the digestive tract. You can see the diarrhea or constipation, they can affect mucus in your stool. Bloating. Bloating means it just in the intestine. In the large intestine, bloating takes place means 2-3 times he feels that evacuating bowel have done or not. Sometimes you'll be going 2-3 times, bloating, blocking, may not come completely removing the fecal matter from the large intestine. Abdominal pain and cramp will also comes in this irritant bowel syndrome. This is due to diarrhea, constipation, mucus in your stool, bloating, abnormal pain and cramps in your abdominal surface area. Irritable bowel syndrome is a common digestive disorder that causes abdominal pain and changes in bowel movements. Symptoms can be included abdominal pain or discomfort, bloating, cramping, diarrhea or constipation, mucus in stool, urgency, feeling of incomplete evacuation. The special part of irritant bowel syndrome is that it is commonly associated with psychological conditions like depression, anxiety, and somatization. Saccharomyces cerevisiae or cerevisiae is Saccharomyces cerevisiae is widely used in baking and beveraging as a yeast species. Some Saccharomyces cerevisiae strains are also taken as probiotics, aiming to benefit the syndrome of IBS symptoms, irritant bowel syndromes. This is that Saccharomyces cerevisiae. The Anthraquinones paniculata is a plant growing mainly in South and Southern East Asia. It has been useful in patients with irritant bowel syndrome. In Malayalam, there is a plant which we can call as Karyata, or you can say Nilavembu, Andrographis paniculata. The leaf you can see looks very interesting, and it was having a lot of medicinal uses which we are using for even immune gathering. Extracts can be taken, even we are taking for even various, in the pandemic time, this was used by various juices. Boswellic acids are active components of Boswellia serrata. They have been demonstrated anti-inflammatory activity by inhibition of leukotriene synthesis and prostaglandin synthesis. Boswellia serrata Indian frankincense, in Malayalam it can be called as Kungilium, and it is an resins, and it can be solid form of exudates, unorganized drug. Curcuma longa, we know that very clearly. It is the turmeric is a type of herb belonging to ginger family, which is known for the antioxidant, anti-inflammatory, anti-cancer property, and the ability to modulate gut microbiota. Curcuma longa, everybody knows that the curcumin which is present is having many activity used in anti-cancer properties. Functional dyspepsia. Functional dyspepsia subtypes. There are two types of functional dyspepsia: post-prandial distress syndrome, epigastric pain syndrome. And functional dyspepsia is a common chronic condition that causes digestion, and it characterized by persistent symptoms like pain or burning in the stomach, bloating, and early satiety. Post-prandial stress syndrome, this is caused by a meal and feels like excessive fullness, getting full quickly, nausea and pressure. Epigastric pain syndrome, this causes pain, burning, which can occur at any time, and it's not caused by reflex. This does not have to relate to eating. When we talk about this Primula frutescens leaf extract, is a new botanical endowment with prokinetic, antispasmodic, and anti-inflammatory properties, which is a promising candidate for the treatment of functional dyspepsia. It is anise, it is called Pimelia anisum, also called as aniseed, is flowering plant and family Apiaceae. And Primula frutescens leaf which was talking about used for this primula is the leaf, is a garden leaf which also have the extract which can be perfectly used. That is Pimpinella anisum Apiaceae family is anise, known as anise seed, is one of the oldest species used in Egypt, Greek, Rome and Middle East. Its essential oil has been reported to have antispasmodic, serotolytic, serotomotor and antibacterial effect. Pimpinella anisum, Anis pimpinella anisum, also called aniseed, in its flowering plant in family Apiaceae. A double-blind randomized clinical trial has confirmed the effect of Pimpinella anisum on relieving the symptoms of dyspepsia. Now we have to talk about GERD also, which is one acid reflux, gastroesophageal reflux disease, is very common with everybody running, workers and constantly not taking food properly in the right time. Common symptoms of GERD, or you can say gastroesophageal reflux disease, heartburn, usually after eating, which might be worse at night, chest pain, nausea, bloating, gas and belching, certain food intolerance and difficulty swallowing, regurgitating of food or sour liquid, sensitization of a lump in your throat, disturbed sleep, chronic cough, new or worsening asthma, laryngitis. And acid reflux occurs when stomach acid flows up into esophagus, causing a burning sensation in the chest or throat. It's also known as heartburn. We are talking about the brown seaweed. It contains alginic acid, is a polysaccharide from brown seaweed used in GERD, gastroesophageal reflux disease. It has been also used for many years in food, cosmetics and pharmaceutical products as an approved ingredient by FDA as emulsifier, thickener and stabilizer. Aloe vera has been reported to possess a biological effect on the wound healing, antimicrobial effect, anti-inflammatory effect and anti-proliferation also. All of these properties are important for the treatment of gastrointestinal or gastroesophageal reflux disease, GERD. Aloe vera is an extract of Aloe barbadensis which has wide application for the treatment of GI disorders, especially gastroesophageal reflux disease. Thank you for listening this short class. Try to listen to this nutraceuticals and other some important nutraceutical plants we will discuss in the next class, and you can have an application or have a listening to various type of classes which is available in questions which is asked by Kuhas, also I have given in my channel. Thank you.